All right, let's go ahead and get started. Thank you again for everybody for joining. I am Eric Cox. I'm a member of the Netcapital team. Um, as always, we are here today with a company that's actively raising capital on the Netcapital platform. I'm super grateful to welcome the team with CureLab Veterinary onto this webinar. A few quick housekeeping items. Please do use that Q&A functionality built into Zoom. I know there's also a chat feature, but Q&A makes it so much easier to track all the questions as they come in. And we do want to get to as many of those questions as possible. So please do use that Q&A feature. Feel free to engage with the chat amongst yourselves and share where you're calling in from. We do want to keep this interactive, but if you have a question for the panelists, please do use the Q&A feature built into Zoom. I'm gonna go ahead and add a link to the offering page into the chat here so everybody can review extra information. And I'm adding that now, here it is. But of course, since I mentioned, of course, CureLab is actively raising. You can go to netcapital.com/companies/CureLab Veterinary, or you can go to netcapital.com and search CureLab, where you'll be able to find the offering page and learn more. And if you're so inclined, you can invest. So with all that being said, please let me get out of the way here. Robert Devlin and Alex Schneider, welcome. Thank you so much for joining me. And go ahead and tell us a little bit about what you're building with CureLab Veterinary.
Well, thanks, Eric. I'm really excited to be on the Netcapital chat and really proud to be able to share the CureLab, a little bit of the CureLab story, and that we have published clinical studies showing that our product, ElenaVet, saved 10 of 11 dogs with breast cancer. And we're looking to increase that in other areas as well. And we have additional published, positive, unpublished data in cats, and we are aggressively looking at even more indications for our product, but wait, I'll talk about those later. I want to first step back and kind of go through CureLab Veterinary as it grew as a sister company to CureLab Oncology, which is our human sister company. And it turns out that humans are a really good model for dogs. In our translational studies, our plasmid, our active product, was shown to provide great benefits to both dogs and humans that have breast cancer. And I'm going to let Alex Schneider, our founder and the molecular biologist, kind of step back and give a little bit of the founder story, if I may, because he's kind of the brainchild on all this plasmid technology.
Thank you, the organizers, and thank you, Robert. My ambition is easily attainable because my ambition is to be the weakest member of CureLab team, both CureLab Oncology and CureLab Veterinary. And I'm excited to work with such an excellent team of people. Our VP of R&D, Dr. Vlad Gabai, I have stolen him from Boston University. He has published over 100 papers in top scientific journals, and those papers have almost 5,000 citations, 5,000 references to his work. I am a molecular immunologist, cellular immunologist by training. Born and raised in the USSR, and when I ran away from the back then evil empire, I was first homeless at French streets. If you put your back to Arc de Triomphe, face to Champs-Élysées, I was sleeping on your third bench on the left. Fast forward a few years later, a scientist at Harvard Medical School, and then with the lab from Harvard, we moved to Boston University. Currently member of the editorial board of internationally recognized scientific journals directly related to our work, international reviews of immunology and aging, because yes, our product works through modulating immunity, and yes, it works through the same mechanism which is identical for cancer and for aging. That's why we approach different things going through from the same route. And Robert, may I ask you to lead from here and introduce a more business side of the team, because as both Doctor of Veterinary Medicine and an MBA, you would do a better job than me doing that.
Well, sometimes. Yeah, I think we've really, Eric and group, I think we've really assembled a great team of experts in their respective fields. And for us, I think we've got a great synergy to be collaborative in overcoming issues and we solving challenges. As president of CureLab Veterinary and as a veterinarian myself, my charge is to provide leadership in key areas like, as you'll see later, the USDA CVB approval process, where we're going to have to go through the US government to get approval of the product, understanding the veterinary market analysis, the logistics of getting products through the veterinary channel, both in the US and Europe, and working with other veterinary academic and board certified experts that we're going to be dealing with to spread the message about our products once we get it to conditional licensure. And actually, we're working with a great veterinary scientific board, even in advance of the launch, to engage them and get them excited about the product and also to get their feedback. I'll be working with other animal health companies to collaborate with them, and as we go along to talk about potential licensing and investment. In fact, I'm going to be heading to Berlin to the Innovation Summit, the Animal Health Innovation Summit, in the first week of May. So for me, I am very excited about the interest that we've seen from Vet Pharma and others. And I think it's a great time, in my opinion, for the Netcapital folks to be able to invest upstream and maximize, hopefully, their earning potential. You can see the screen of our management team, and the one I'm missing is right now is Jason Payne. He's my colleague and our CFO, and he brings a wealth of financial knowledge, and his background is really needed to help guide us kind of nerdy scientific guys and ensure that financially we're making the best collaborative decision possible, whether it's in the area of investment, production of product, cost control, or planning. And so with that, I think we've covered most of the team, unless you have anybody else you want to mention, Alex.
Obviously, who brings us all lawyer jokes? Of course, our lawyer who made us to be successful with getting patents in over 20 countries. Basically, you can study an entire geography course looking at our patent portfolio.
Yeah,
and
we're gonna hit that, I think.
Yeah, but he's a valuable member of a team, although he's from MIT, and people from Harvard dislike those. And other international team members responsible for our local success in Europe, in Gulf, and other areas of the world. So we are not only well-rounded in terms of set of expertise, because if you just take top scientists and incorporate them, they would chapter 11 before you finish your coffee. But yes, we are well-rounded profession-wise, but also very well-rounded internationally, because each major region has its own peculiarities.
Sounds good. Eric, do we want to jump into a little bit more into the ElenaVet story itself, the product itself?
Yes, please. Tell us a little bit about the product itself and how you're building the company. This is perfect. Thank you.
All right. So ElenaVet, our product that we're bringing to the market, is a P62 plasmid, and probably Alex, you're probably the best, as a molecular biologist, you're probably the best one to explain what it is and kind of how it works. And then I'll jump into what it does in the body and the animal.
Talking what it does, it pays a tribute to my wife, Elena. That's why it's ElenaVet. Okay. And I wouldn't call it Elinavet unless I was absolutely 200% positive of the quality. Basically, imagine a molecular envelope, but not an post envelope where you put your letter, a circular DNA envelope. And you put a letter in that envelope. It could be a love letter, or it could be a hate letter. It could be a business letter. That envelope, if it is a circular DNA, is called a plasmid. And you insert there your unique letter. And in our case, that unique letter is called P62. And let me tell you something. I think I'm the only guy here who is not that smart. Everybody else, if he's a PhD, would come and tell you how smart he was to envision a great success. We were more lucky than smart. Yes, we were smart enough to hypothesize that if we take that molecular envelope called a plasmid and insert there a molecular letter called P62, we would have an anti-cancer effect. But what we did not expect, and what came as a serendipitous discovery, which is now changing the face of both veterinary and medical science, that it would have multiple effects beyond just cancer, because it would take under control chronic inflammation. And chronic inflammation is important not only for our bodies to develop cancers, but also for aging and developing multiple other diseases. And as a veterinarian, I'm sure Robert would do much better work than me, going from molecular and cellular level to the entire organism level. But later, during question and answer session, if you want to go as deep as you want with mechanistic questions, please do not hesitate. Shoot, I'm here to answer your questions. And if I wouldn't know the answer today, maybe we will share a Nobel Prize tomorrow, because you would give us a good idea to think toward a right direction.
Thank you, Alex. So what does the Elinavet do? Again, as Alex said, it down regulates chronic inflammation. And as he said, this is, you start out with inflammation, and then slowly and surely, if it continues, it'll jump into cancer. And so we want to stop those inflammatory mediators. It also changes a great thing is it also changes the tumor microenvironment. The tumor stroma, or the structure of the tumor itself, not the cells, but the structure of it, changes and makes it less dangerous. And it allows our product and other chemotherapeutic agents to penetrate deeper and do a better job. Our product also reduces and prevents metastasis. So it contains those cells and keeps them from spreading all over the body. And because it changes the structure, it also enhances the anti-tumor response, allowing those T killer cells to go ahead and enter that tumor and do the work of killing those bad tumor cells. Plus, it inhibits the tumor's ability to suppress the immune response. So all of these four things make it a novel product, and actually very complementary to conventional anti-cancer therapy. So for us, as I'll talk about later, even when we look at competition, we don't really feel there's a lot of competition. This is a novel process that no one that we know of is doing right now. And I think it's going to be a go-to product for anti-cancer in animals, probably along with the conventional ones that everybody knows. But it is not a or a B. Ours will make theirs even better. But we've talked a lot about breast cancer and that, but we know that we can work and decrease metastasis for melanomas. But as we spoke about earlier, based on the anti-inflammatory properties, we're now looking at even wider areas. inflammatory bowel disease in dogs, osteoarthritis in dogs and cats, cat disease of triad, which is more the liver, pancreas, and that area, chronic dermatologic cases and renal issues or kidney issues that go on from long term. If we can also ameliorate these, the market is going to be even larger as we look at these other indications. As we said, we don't think there's going to be a lot of competition, and actually we're going to be probably the go-to product for a lot of the cancer modality. What we're first going to need to do, though, is we're going to take our initial product, the Elena-Vet, and initially go through the USDA, and we're trying to be very smart about it and take it also to the EU to begin to sell the product through the vet channel and raise awareness to veterinarians about the novel technology for saving their patients. And again, we're using that veterinary advisory group to help spread the word. Alex, do you have any comments on this?
Just to reiterate your thoughts in two ways. First, imagine a company which came up with automatic transmission. Is it in competition with a company which is manufacturing car engines? Of course not. Is it in competition with a company manufacturing car tires? Of course not. The more engines or the more tires are available to the automotive industry, the more demand it would be for automatic transmission product. The same is with us. Our product makes other products to work stronger, to work more efficiently. And it was to the greatest, now not Alex the founder, but Alex the professor speaking. I was very surprised to see that with dogs and with cats, for cancer, our product works as a standalone medicine, and applying Elena-Vet alone, we have such great historical results. In humans, we didn't even try it. For example, for the deadliest form of ovarian cancer in women, we immediately combined it with standard of care chemotherapy and have a historical results, which is now picked up by the #1 authority in gynecologic cancers in America, a gynecologic oncology group. And it shows that if for veterinary medicine, we may be applied as a standalone product, for human medicine, nobody would even care to talk about competition, only about combination. So we don't have potential competitors, in my view, we only have potential partners and potential collaborators.
Exactly. I think that's where we're really looking at, because again, whether it's a human or your favorite pet that you love dearly, what we want to do is get them better.
Absolutely. And when we're talking about chronic inflammation, there is a big, almost a philosophical difference, which came out of our serendipitous discovery. Once again, I was not that smart. I was more lucky than smart. There are bigger companies, much bigger companies, which try to intercept one or another cytokine of chronic inflammation. It's called pro-inflammatory cytokine. The problem is that this is a dead-end approach because the system is very redundant, and if you intercept one cytokine of chronic inflammation, pretty soon another one would replace it. We are lucky to report to you that we're not intercepting or reducing any particular cytokine of chronic inflammation. Instead, we are reducing the entire spectrum, the entire comprehensive spectrum of pro-inflammatory cytokines. And at the same time, we are elevating the entire spectrum of anti-inflammatory cytokines. During the question and Q&A session, if you are interested, I can go into more molecular and cellular biology behind it, but the important part is that we're fundamentally different from anybody else because we're not intercepting any particular one. We're working on a comprehensive and holistic scale.
Yeah, no, I agree, Alex. And that's why our modality is really novel. A lot of companies out there are also using monoclonal antibodies, which is, can be very expensive. And again, only targets one thing. And so we have a lot more flexibility with our novel plasmid product.
No, that's really great. And I know you have a couple more slides queued up, but I did want to ask, for those who aren't super familiar, aging in pet populations, can you talk a little bit about what the numbers look like? I know on the offering page, when you discuss the problem, you talk about the incidence of cancer and osteoarthritis in cats and dogs. Can we dig a little bit deeper into that for a moment?
Sure. I will tell you as a veterinarian, anytime you get a pet that's probably approaching 10, you're going to have almost 50% of them starting to look and they will probably develop cancer. I mean, the breast cancer market alone in the US is about 159 million, but as I said before, we're also looking at the EU because in Europe, they aren't as proactive at spaying and neuter. In fact, they think it's almost detrimental to the pet to spay and neuter them. They think it's an abomination. So there's a much higher incidence of breast cancer there. And again, that's only our first indication we're going to be targeting because again, that was a low-hanging fruit that Alex got from that translational data. But now with the additional data that we have and the additional studies that we're doing, we're looking at many more indications that we're going to be going after. Again, like osteoarthritis, which is a huge marketplace. Inflammatory bowel disease just traumatizes lots and lots of dogs, and they have to be on special diets, and even then they have problems. So again, I'm very excited, as you can probably hear from Alex too, about bringing ElenaVet to the marketplace, because I think it's going to help really save a lot of lives and extend the quality of life for a lot of patients. Alex, do you have anything else on that?
Not really. I would say that in wild nature, neither dogs, nor cats, nor even horses, not even humans were evolutionarily designed to live so long, okay? But now we have a dog, Sparky. Can Sparky be eaten by a predator? No. Can Sparky die of starvation? No. Die of cold? No. Not being vaccinated? No. So Sparky will live long enough to reach all the same problems of aging and aging-associated diseases. And we work with multiple cancers, both in dogs and cats. The fact that we published mostly on breast cancers in dogs doesn't mean that we will not publish or release soon our rabbits we have in a hat for cats and for other cancers. So there is no any fundamental difference between human anti-aging and veterinary pet anti-aging medicine or problems. And we are on the cutting edge of approaching both through two sister companies.
No, that's super helpful. And for those who haven't visited the offering page yet, I want to remind you that there is a link directly to that in the chat. And we're about halfway through, so I'll remind folks that CureLab is actively raising on the NetCapital platform. You can go directly to netcapital.com/companies/CureLab Veterinary, or you can go to netcapital.com and search CureLab. But a couple of really important details that were shared on the offering page include every other dog or cat over the age of 10 will suffer from cancer. Cancer is the #1 cause of death in dogs, which was shocking to me, even though I know that especially in larger breeds, it's incredibly common, but across the board, #1 cause of death. And then 1 in 4 dogs and 1 in 5 cats will develop cancer. And then lastly, 80% of dogs over 7 and 90% of cats over 12 will suffer from osteoarthritis. So just really a massive level of application here and some real potential help on the horizon with CureLab. So thanks for sharing those data.
Yeah, no, thank you for reiterating those.
We're
Again,
having
I
some
think go ahead.
No, I was going to start to pivot over to the business model, but I want to let you go ahead and wrap up your
Sure.
thought there first.
So I think that it's perfect timing to talk a little bit about the business model. And so right now we're raising capital, obviously through Netcapital, so we can fully go through the USDA process for conditional approval. We've already met with the USDA and the FDA, and they looked at the product because we kind of don't fit in a typical drug nor the vaccines that they are used to, because we're really unique. And we are actually been classified to go through the USDA CVB, Center for Veterinary Biologics. And we've already identified a similar one in the EU. And so as we look at working with our researchers, our regulatory people, we're going to try to maximize the spend, or not the spend, but the economy of our spend, so that we can cover as much of that regulatory need as we have for both markets. Typically, to get the USDA approval, we're looking at probably 2 to 3 years. And again, working with our talented team, the USDA, because again, the USDA actually can be quite helpful because they want to bring great products to the marketplace. And so we've already started our discussions with them. And I think hopefully that will keep the time to a minimum and gain both USDA and EU approvals in as short a time as possible. And again, once we get conditional licensure, we can begin to sell the product. Now we've got positive revenue, and then all we're doing after that is confirming what we already know to get the tick in the box from the USDA for full licensure. And even in advance of that, I'm sure Alex will be prodding me and doing things to kind of start working on those secondary indications. So we may have multiple things going through the USDA. But initially, the raise, again, as we look, we've raised within the last 8 months, 2.5 million. And Alex, do you want to talk about the 2.5?
Yes, absolutely. English has a grammatical feature. Once I took a course at Harvard, English grammar for native speakers. At the first class, a professor looked at us and said, most of you are not native speakers. So there is only one unattainable feature in English grammar for you guys, as and these. So we don't have an investor. We have the investor. And the investor is John Ballantyne. He is one of the most successful biotech entrepreneur in biotech history. He came to America as a postdoc, and together with Michael Chambers, they started Aldevron with $50,000, and then Aldevron was sold for $9.6 billion. And their specialty was contract manufacturing of plasmids. So we developed our product, and then we hired Aldevron to produce it for us. Thus, we were under Aldevron observership all the way through. And when they sold Aldevron, John invested into us because he knew everything. He knew every nucleotide of our product, like every letter of a book. And I think it's very important that the money came from such a great, indisputable expert as John Ballantyne. And when we started later this crowdfunding, the first 100,000 came from another guy who I respect enormously. He's a serial entrepreneur in Germany, Pierre Blumenschein. I think back in the day, his IPO was one of the most successful IPOs in German history. And, you know, melted innovation goes in his vein instead of blood. And when he has learned about our crowdfunding, he immediately invested first 100,000. So having two such experts who asked all the tough questions with no mercy, I think, to me personally, it goes beyond just money.
No, that's
Alex,
great.
I have to pause for a moment. If I ever accomplish enough in my life to have a memoir, I need you to narrate it. I think you just have to read that for me. And then I'd also like to welcome and congratulate one of our attendees who just invested in CureLab. So welcome to the CureLab family. You'd love to see that real time during the live Q&A. So welcome. And then, sorry, Robert, I didn't mean to cut you off. I felt like you were going to.
No, that's great. I appreciate it, and I wish I could see more of that. As far as thank you so much for who, because I can't see who did that, but thank you so much for investing.
Yeah, exactly.
As we said, we're looking for $1+ million. We've got some capital. You know, obviously our goal is to get to around 5 million to ensure that we can operate through all the way through full license approval. But again, we'll be revenue positive even before that. And so then we can start working on those secondary indications. The other probably nice thing on that, as Alex said, is not only do we have this product, but a product isn't any good without some protections. And so, you know, CureLab Oncology had all these patents, and we have the as CureLab Veterinary for $250,000. We now have exclusive lifetime license in the animal health channel for dogs, cats, and horses for all these patents, not only oncology patents, but patents from inflammation too, so we can cover osteoarthritis and the other, already well in advance of where we want to be down the road by doing all of our homework ahead of time. Alex, do you?
Yes. Rob, everything you said is correct, but we also have to add that not only CureLab Veterinary has worldwide exclusive license for existing patents of CureLab Oncology, but it will always have worldwide exclusive license for pets, for dogs, cats, and horses of all the future patents. Because, guys, let me be honest with you. When me and some of our scientists, when we came to America, we were so poor that you don't want even to imagine it. When I was driving from University of Louisville to Harvard Medical School, my wife gave me a chicken so I wouldn't waste money on going to McDonald's driving from Louisville, Kentucky to Boston, okay? And what brought us out of poverty and made us, according to American standards, very comfortable is that first, we were hired by some insignificant companies like Microsoft or Procter & Gamble and stuff like this to help with their IP, not only developing their IP, but also stealing IP of their competitors. Thus, it would be a very daunting task to challenge our patents. Majority of patents don't worth the paper they're printed on. They're window dressing patents. We don't have, and never shall we have, window dressing patents. We will be able to win every challenge to each and every patent we do have or will have in the future. And CureLab Veterinary will have a worldwide exclusive license, not only for existing patents, but for all the future patents. And for the sake of time, I will not elaborate on that any further, but during Q&A section, feel free to ask me what are the next set of patents we just recently submitted, and we will make this information public very soon. It's a pretty cool piece of scientific discoveries.
Thank you so much for that, Alex. And that's actually a perfect transition in these last 15 minutes that we have together. We talk a little bit about the market size from a revenue standpoint and then the revenue model. So I'm not sure if you have the numbers on hand, but could you tell the attendees here a little bit about how large the global animal health market is?
The wider global health market is, I think, and you probably have it because I'm not looking at it right in front of me, but like $256 billion as a wider market when we talk about all the animal health products that are out there worldwide. So it's a huge market, and I think we're poised to really launch off of this with our first offering in the breast cancer, but hold on to your britches, because we have all these other things that we want to spring and bring to the marketplace to be a even bigger, more robust company as we look at a lot of these indications that are huge problems in the marketplace that people are wanting things to help ameliorate and solve them.
Yes, I think from your offering page, we see that cumulative annual growth rate of about 5.9%. So that's also, so it's large and projected to grow, which I think is always important to add there. And then if we could talk a little, go ahead.
Yeah, pets are, I was just going to say it, and a little bit will be on our last slide, but, especially in millennials, pets, they're putting off having kids, and pets are their kids. And so even today, a lot of people, we see a lot of investment going into the animal health marketplace. Why? Because while it's not recession proof, many people call it probably one of the most recession resistant areas in our economy, because people love their pets. You saw pets being adopted during COVID. They were bored and stuck at home. They needed somebody to be with, and people are looking, spending more than ever in the United States and actually in the EU on treating the pets because they live longer. And so the average pet spend continues to grow, and we're happy to be a part of it, and we're happy to help them live longer because they make such a difference in people's lives. I mean, and I'll go through that in a second.
No, that's a really important point, Robert. Thank you for sharing that. And as you're preparing for that last slide, we talk a little bit about the business model, and then we could talk about some of your next major milestones.
Yeah, the next major milestones, as we talked about, probably, the first one is obviously the approval from the USDA CVB. And then we're going to look at the next thing we're going to do. Obviously, we want to finish any investment raises. So that's got to be a big milestone too, because we want to get there. We have so much excitement and our product and the team that we can achieve our goals. So getting that is another major milestone. I think when we look at it, we're on a trajectory, hopefully to build this company to where we have really three big areas where we can either, I know that Alex is, as you can tell, he's maybe pretty robust in his knowledge about plasmids. And so we're looking at production, and we can either produce all these products ourselves, and with my background in animal health, we can do the go-to-market, but we've also seen that the larger pharma companies have interest, and so we can either license to them, or if they want to show us even more love, there's an opportunity down the road that they, if they want to buy the product, we have that. But those are kind of the major milestones right now, or just getting through the EU and USDA process, and again, just getting the additional support that we need to get there.
No, that's perfect. Yeah, and I know you alluded to that. I think we give a little bit of time toward the business model, and then we have a couple more questions that just came in that I want to cover.
Sure. The business model, again, once we get licensure, is to, again, prove the model by taking it to the veterinary marketplace. And again, that market, we know that we have a business model where we think what the product will cost. And, we don't want to go through all the financials right now, I know, or the projections that we think we can get. But that business model will be very easy to go through the veterinary channel with the distribution model that we have, and we can either do that directly with the veterinary distributors, or again working through pharma. For me, the future of CureLab Veterinary is really bright, given the studies we've already performed, and that we're extremely confident in their repeatability and the likelihood of us gaining that licensure. We have those additional indications that will only enhance our stature and the financial performance that we're going to have in the veterinary channel. And as we've talked about earlier, we know that pets are part of the family, and we're excited to help our four-legged family members live longer, healthier lives. A little bit here, we talked about this, but our timing, we've talked about selling it ourselves. I'm sorry I didn't jump into this slide a little bit earlier, but selling the technology. Likely we're looking at, again, 2 to 3 years to get the conditional approval for so that we can be more revenue positive, and then 5 to 7 years, we have lots of options for either the other indications through the USDA and the EU as we move along. And then we have decisions to make from a revenue standpoint. What do we want to do? Whether we want to keep it ourselves and continue to grow, or to move to other options. Alex, you want to weigh in on anything?
Go ahead, Alex.
Me?
Yeah, if you want to.
Basically, I'm not an MBA like yourself. So in my simple mind, there are two types of products. Products which people ask themselves, can I afford them? And another one where we are, where people ask, can I afford not to have it? Think of any friend of yours or a family member when he or she looks at his pet and he has an option to put it asleep or to have few more years of productive friendship with this pet. Can he afford not to bring his money to our shareholders? No, he can't. In modern urban environment, with farmers, it's different. A farmer would take a shotgun and just shoot the beast, more likely than not. But for the modern urban environment, it's not a recession, not recession. I mean, of course, it could be some cataclysmic event of a Hiroshima scale, but other than that, it's not about who can afford our product. It's about who can afford not to have our product.
Yeah, and I think even the rural, some of the rural farmers, I've lived in Kansas, and I will tell you that's their best buddy. It's in their truck and it's out there with them every day. And so whether it's downtown Manhattan or Manhattan, Kansas, in the middle of the state, I think again, like you, it's really, can you afford not to do it? Because again, pets have been shown to decrease human stress, lower their blood pressure. Gosh sakes, with COVID, we know that they helped alleviated the depression that we all saw. And so I think by working together, and again, I think this investment is good for those people that want to invest in a company that's going to really, in my opinion, do very well. But also, even if you're just saying, I'm compassionate about animals, I want to help a company that's going to really make a difference in the world for the lives of animals, I think CureLab Veterinary is an opportunity there as well. And so, there's nothing like those eyes that you see in the picture. And, I have a 20-year-old cat, and I hate for the day that will probably come. I mean, it will come, but I want to give her as much time as possible. And I know, Alex, you've had dogs and cats, and so that's what we're about.
Actually, there was a classic movie, Indecent Proposal, where heroine is driving the main character around a rich neighborhood. He says, let's go to this castle. And she says, this castle is not for sale. And the guy, a billionaire, replies, everything is for sale. So when people ask us, are we for sale for a big or for a veterinary pharmaceutical company or not, we're opportunists. We're not idealists. We are here to bring you and ourselves maximum return on investment. If we want to sell CureLab Veterinary today, we can, but it would not be for the money worth a discussion. If tomorrow a good offer would come to sell the company, we will sell the company. If not, we're 100% self-sufficient to provide manufacturing and everything else. And by the way, for manufacturing, we have tricks like nobody else. Like we can produce the same amount of product, saving water and solutions 10 times next to anybody else. So our cost of goods would be much cheaper with the same quality as for anybody else. And when Robert mentioned monoclonal antibodies as a competing type of a product, guys, I'm a simple-minded biochemist. Monoclonal antibody is not a molecule. It's 4 protein molecules very tightly associated in the space. Plasmid is just 1 molecule without this tight association. So plasmids will always be 2 orders of magnitude cheaper as cost of goods next to monoclonal antibodies. They cannot compete. And on this planet called Earth, as far as biochemistry is around, they never will be able to compete because it's a much more sophisticated product from production and quality control standpoint. Did I communicate myself across clearly, or was it convoluted?
I think for the rest of the PhDs in the audience, I think they're right there with you, Alex. I think you did about as good of a job as you could have. So thank you for those details. Last couple minutes here, and I do have to get these questions in that came in. So they kind of tie well together. So patents are good, and this goes to the IP competitive landscape and defensibility. Patents are good as long as they are enforced. The key is how soon can you start making money to break even and then decide about the next step. So that ties to the other question. What is your ballpark timeline? And no one's going to hold your feet to the fire here, but can you share a little bit more details about your timeline and cost to break even?
Yeah, I think when we look at timeline, I think it's, we do have a government agency there. The good thing is the government agency does want to, generally speaking, does want to bring products to the marketplace, especially in animal health. But again, we're still going to have to go through a rigorous process to do that, and that's going to be a 2 to 3 year process. And then realistically, we think once we get conditional approval, the numbers we've run, and again, we probably need to run them again now that Alex we haven't been sitting on our hands. He's been working away on the production side of it and has improved the production, as he said, to drive the cogs down. So I think we looked at within 18 months to, again, probably 2.5 years, we'll have broken even with our initial investment needs.
Well, I thank you so much for that. Alex, is there anything else you'd like to add as we wrap up here?
Not really, except one important thing. If you are becoming our shareholder, you are joining a CureLab veterinary family. So don't wait till annual shareholder meetings, because that day is as good day as any during 365 days of a year. Our entire management team, myself included as a founder, but our president, our CFO, we are business-wise, you are family members, and the only stupid question is the question you have hesitated to ask when you have it. Okay, our doors are always open for you, and if you want to ask a question, ask it. If you want to stipulate a suggestion, suggest it. You are joining a CureLab family.
Oh man, I love that. The availability for communication with potential investors and investors, I absolutely support wholeheartedly, and I appreciate you sharing that comment to wrap us up here. Okay, so thank you so much for everybody for joining. Thank you to all of our attendees.
Excuse me, I can read one. We're investing in CureLab Veterinary, but the patents are held by CureLab Oncology, right? Not quite right. The CureLab Oncology gave CureLab Veterinary worldwide exclusive license for every IP it has for dogs, cats, and horses. So for these 3 animals, for dogs, cats, and horses, CureLab Veterinary legally became the owner of the IP rights. Did I articulate it clearly?
Through that license, yeah, and thank you so much for getting to that right before we wrapped up there. And yeah, they wanted to confirm. So yeah, thank you so much. And that was from an investor. So thank you for taking that time and catching that, Alex.
Okay, sure.
Awesome. No, I think that was a perfect conclusion. Thank you, everybody. As I was saying, thank you for the folks that listened and invested. Thank you so much for the attendees and your thoughtful questions. As always, CureLab is actively raising on the Netcapital platform. I added a link to that in the chat earlier, but I just added it again. You can select the link in the chat, or you can go to netcapital.com and search CureLab, or you can go directly to netcapital.com/companies/CureLab Veterinary, where you can review the offering page. You can see more information there. There is also a Q&A feature built into every offering page. So if you weren't able to ask your questions here, Alex was very explicit in saying that he's available for your questions there. So do feel free to use the discussion section of the offering page there to ask your questions. And then if you are so inclined, feel free to push that invest button. So thank you so much for our attendees. I want to thank both Robert Devlin and Alex Schneider for coming on and sharing their perspectives and what they're building with CureLabs. I really appreciate you taking your time. And I hope this was informative for everybody. I know it certainly was for me. As a grateful and proud family member of a 3-year-old pandemic puppy, I cannot even think about the day that we will not be together anymore. So I'm just grateful for the hard work that your entire team is doing at CureLab.
Thank you so much for everybody's
you.
time and kind attention.
All right, everybody, enjoy the rest of your evening and take care. Thank you so much. Actually, one last super thing. Sorry about that. As always, this has been recorded. It will be available on the Net Capital YouTube channel. I just added a link to that into the chat. But of course, you can just go to YouTube and search for Net Capital. I imagine if you go to YouTube and search for CureLab, that will probably also trigger it. But this has been recorded and will be uploaded shortly. So if you missed anything, or if there are folks that you know that were unable to attend, or if there's anybody that you think would just be interested in learning more about this opportunity, please feel free to share the recording with them. And hopefully they will get the information they need and potentially invest as well. So I just added that link there. Feel free to check that out. Thank you so much for everybody and have a great evening.
Thank you.
Thank you.
Bye now.
Bye.